Caffeine is the most commonly used psychoactive drug in the world. It is a bitter white powder that was discovered by a German chemist, Friedrich Ferdinand Runge, in 1819. Humans have taken in caffeine since the Stone Age by chewing on seeds, bark, or leaves of certain plants. They found that by doing this, they weren't as tired and had increased awareness and lots of energy. Caffeine can be completely absorbed into the body within 30 to 45 minutes and diminishes in about 3 hours. Caffeine can affect things such as mood, stamina, cerebral vascular system, and gastric activity. Caffeine is naturally found in certain leaves, seeds, fruits, and in more than 60 plants from around the world. Caffeine is also synthetically produced, and you can find it in food, drinks, supplements, and even medications. In North America, they found that 90% of adults consume caffeine on a daily basis, which is a pretty high number. I'm going to show you a few examples of caffeine-containing products. Here we have energy drink, which is loaded with caffeine, and Coca-Cola, Diet Coke, and chocolate. The most common sources of caffeine are tea and coffee. And I do have a handout here if anyone would like to look at it. It has different amounts of caffeine for foods and drinks if you want to look. A moderate dose of caffeine is about 200 to 300 milligrams, which is the equivalent of 2 to 4 cups of coffee per day. A heavy dose of caffeine is about 500 to 600 milligrams, and it's the equivalent of 4 to 7 cups of coffee a day. One reason that caffeine could affect a person or not is how much caffeine they're used to taking in. The more caffeine someone's used to taking in, the more that their body can handle. Another reason would be a person's body mass index, their age, if they've smoked, drug or hormone use, and anxiety disorders. Now, there are some positive effects with caffeine usage. It can improve concentration and mental alertness for a period of time, and it can help an asthma attack by relaxing tight bronchial muscles. It increases urine flow, digestive acid production, and relaxes smooth vessels that control blood vessels. It also improves athletic performance by temporarily increasing muscle strength and endurance. It does also stimulate the nervous system, so it rids off fatigue and increases wakefulness. This is why many of us like to have caffeine, and it becomes an addiction. Now, some negative effects are it is mildly addictive and can cause withdrawal symptoms such as headaches and irritability. This may appear anywhere from 12 to 24 hours after caffeine is last consumed, and it peaks at about 48 hours. And the symptoms can last anywhere from 1 to 5 days. It can also include insomnia, tremors, anxiety, heart palpitations. It lowers the body's absorption of calcium through the loss in the stools and urine. It increases production of stomach acid and temporarily increases blood pressure and heart rate. It can also cause miscarriage or low birth weight babies. Now, there's an old myth that caffeine can stunt your growth, and this is proven by scientific research that this isn't true. Caffeine does have the same effects on children as it does in adults. Their little bodies just can't handle the amounts that adults do. Excessive use of caffeine can also increase the cortisol level, which especially women want to worry about. It causes rapid weight gain, irritability, heart disease, and diabetes. Now, overusing caffeine in large amounts can cause something called as caffeinism. And those are it has a lot of the symptoms that I explained before, some of the negative things that can happen. Severe caffeine intoxication with high serum levels of caffeine may require such treatments as peritoneal dialysis, hemodialysis, and hemofiltration. As you can see, the negative effects of caffeine definitely outweigh the positive effects. Caffeine in small amounts should have little effect on a person. You just need to watch what you consume and make sure you're not drinking too much caffeine. And I hope that everyone enjoyed learning about caffeine and the effects it can have. And if you have any questions, I'd be happy to answer them. Thank you very much for coming.
Yay. Very good.
How long?